Texas Children in Nature Network, and we really appreciate you joining us for our webinar today. The webinar title is Creating Clinical Community Linkages to Foster Improved Health Outcomes in Urban and Rural Areas Utilizing Nature as a Strategy. And our presenters today are Dr. Jennifer Connor. She's the Vice President of Rural Health for the American Heart Association in the Southwest region. We also have Veronica Sanchez, the Senior Director of Healthcare Systems and Community Impact for the American Heart Association in the Greater Houston area. And then we also have Jessica Donze Black, and she's the National Vice President of Community Health with the American Heart Association and American Stroke Association, and she's out of the national headquarters based in Dallas. So thank you all for being here today. It's so exciting to have so many presenters. We also have Melody Alcazar with the City of Austin Parks and Recreation Department, who's helping us with our tech support, and she'll also be taking attendance for this webinar. And Melody is one of our dedicated tech helpers, and she's also the program manager for the city's Connecting Children to Nature for the City of Austin. So we're happy to have her help today. We do have automated closed captioning available for this webinar. You just have to click the Show Caption CC button on the Zoom toolbar for the live transcript options. We are recording our session today, and so to save bandwidth, we ask everyone to please turn off their cameras and mute themselves during the presentation. I'll be doing the same. I will be monitoring the chat during the presentation to share your questions. So you can share your questions there, and I'll be looking out for them, and then we will read them out loud and have our presenters answer during the Q&A portion of the webinar. And then I'm sure everyone is super nice, but we always like to just remind people to be kind to each other in the chat when you're posting your questions and your comments. I will be sharing the recording of today's session and a follow-up email. So if you're uncomfortable with your name showing, you can change your name to anonymous and then private message Melody with your name for our attendance purposes. And you can change your name by hovering over your name, and then you'll see 3 dots that appear. You just click on those dots and you can see where you can change your name. And then also, if your Zoom name doesn't match the name you registered with, please change your name or private message Melody with your name, again, for attendance purposes. And then this part is important, especially if you want that certificate of completion. Only the registrants that attend the live webinar are eligible to receive a certificate of completion, and we do not automatically send that out to all the attendees. You must request the certificate after attending the live webinar, and the email that you received from Sarah with the webinar Zoom link has the specific instructions for requesting the certificate. And we do take attendance during the live webinar, and we will check our attendance list to confirm your participation. And we do need the name that you registered with to issue the certificate. So that was a lot of housekeeping. I have one more very important thing, and that is our land acknowledgement. The Texas Children in Nature Network is headquartered in Austin, and as such, I am on the ancestral and unceded land of the Tonkawa, Comanche, and Sana people. Our ongoing colonial presence on indigenous lands compels us to take action now to counteract the effects of colonization. The work we do through the Texas Children in Nature Network is just one small step towards that effort. And here shortly, I will put some information about indigenous peoples groups and land acknowledgements in the chat for your information. And again, we appreciate you being here, and we have a very special webinar planned for you all today. And so with that, I'm going to go ahead and hand it over to Jennifer, our first presenter. Thank you.
Thank you. Yes, thanks so much. And we just, again, are very appreciative to the network for letting us be here today. I'm going to share my screen. Let's see, and everything. Okay, can everyone see my screen okay? All right. So again, my name is Jennifer Connor, and as she said, the beauty of the presentation today is that I work at our regional level, Southwest region, so I cover Wyoming, Colorado, New Mexico, Oklahoma, Arkansas, and Texas. Then you're going to get a very local perspective from my colleague Veronica in the Greater Houston area. It's going to talk about some of the work. And then we're very fortunate to have our national VP of Health on, and you can really see what we're doing both at a local level, a regional level, and a national level. So we are excited today to talk about our clinical community linkages. In the health space, we know that it takes both everything outside of the clinic walls and everything inside the clinic walls to comprehensively address our health. And then I just wanted to point out that we're working really hard to take some of the programs that we have in our urban areas and really move those to our rural areas. So, as the Vice President of Rural Health, you'll hear me talk a little bit about how we've conceptualized our rural work at the Heart Association, spend a little time on that, and then really see how we've operationalized this through Jessica's presentation in our heart course. So with that, we'll go ahead and get started. You can read the text on the screen, but basically the Heart Association is very much committed to health equity. Our 2024 impact goal is that there is the opportunity for a full and healthy life for all. So rural, urban, doesn't matter. How are we addressing cardiovascular health and really removing those barriers to care? In 2020, February, just moments before the pandemic hit, the AHA really took a stance of saying, how will we address rural health? So a board of trusted and rural practitioners and experts really came together, and there was a call to action as part of the AHA. We released the presidential advisory that said, we must address rural, and we've got to figure out the strategies that work. And why is rural really important? Well, we know that about 20% of the population actually lives in rural America. So that's about 60 million people across the US who have chosen to live in that area. We also know that we have an aging population, so about 20% almost are over 65. And while predominantly white, we do know that diversity in rural areas does greatly vary across the US. And notably, Latinos are the fastest growing population in rural, although we are experiencing some outmigration with, declining populations in many of our counties. So within that presidential advisory, after looking at best practices, after really examining the data, looking at what works, there were 3 priority areas that came out of that presidential advisory, and that was increasing access to care, improving healthcare quality, and addressing risk factors. I probably don't have to tell many of you on this webinar that we are seeing a lot of hospital closures. We are seeing, workforce and gap issues in some of our rural areas, and that often rural areas have lower rates of insurance and telemedicine utilization. So these are some of the, again, barriers to access that we noted, as well as quality care. So looking at if you do live in a rural area, what's the quality of the care that you're receiving? And part of that is due to the lack of rural specific quality metrics and really having the data to show the impact of the care that we're receiving. And then there's also gaps in research and a focus on rural populations. I mentioned it before, but a lot of workforce shortage also contributes to this. And again, we're excited to have Jessica here to talk about some of the ways that we're addressing that. Also, when we think about the risk factors, and that's really where physical activity and the topic we're going to talk about today comes in, we know that there's higher rates of hypertension and diabetes, obesity, and tobacco use in our rural areas, as well as food insecurity, lots of food deserts in most of our rural places. With just like hospital closure, we've got grocery store closures and also affordability of food. And we also know that we have social determinants of health, including health literacy. Do you understand the materials and education that's been provided to you, as well as things like housing, transportation, college attainment, those kinds of issues? So again, all of these put together, we really said, now we know what our 3 target areas are. How are we going to do that? So on the screen in front of you, you'll see some of our rural strategies under each of those, where we are looking at Medicaid expansion, we are looking at maternal health, we are looking at telehealth, but also investing through our social impact fund, looking for innovative opportunities to invest in rural strategies. But really on the right side is what you'll hear a lot about today of, again, how are we improving that quality of care and really using nature, physical activity, food security as ways to control blood pressure, reduce strokes, control diabetes and really improve the health of all of our citizens. So again, I'll take the topic of just showing you all the things the American Heart Association is doing, and then we'll drill down of how this really clinical community linkage comes together to work. So within our healthcare system, we are working, of course, with rural hospitals. This is on the hospital side of things where we are do programs like Get With the Guideline. It's called our Rural Healthcare Accelerator. But this again is as you hit, the door of a healthcare facility, are you receiving that best quality of care? Is, the medical staff providing and following all the latest guidelines? So that's a great program that we have for our rural hospitals. On our outpatient clinical ambulatory side, we are again working to improve cholesterol, to reduce diabetes, and to help control blood pressure. So just know that as we're also talking today about our walking programs, we're working in that clinical space to make sure that that quality of care is being provided. On our community side, you're going to hear a lot again about our Walking RX program and our HeartCore program, but we do again realize this sort of system of care approach where nutrition security, physical activity, diet, exercise, those risk factors kind of all come together. So a great example is we are working with many SNAP programs. This is an example in Wyoming where we were working with Albertsons to try to increase SNAP education and SNAP enrollment through media campaigns and through working with our food security partners like food pantries and food banks to really encourage enrollment in SNAP. We also know that at the collegiate level, there are food insecurity examples. So here in Texas, we do have our collegiate food pantry collective that's being led out of our greater Houston market where Veronica and her colleagues are, and really trying to engage with college campuses to make sure that we are addressing food insecurity. We know that what our children learn and enjoy as their food preferences at that small age kind of follows them into adulthood. So again, really trying to look at that holistic system of food security over the lifespan. We know in rural areas too that our library is a great community hub. So we do have several examples in Pottsboro, Texas, for example, where that library has become a community hub and summer feeding program site, and really trying to help address food security through that, as well as screen their patrons for high blood pressure. In Wyoming, we also have an example where you can go to the library and check out a blood pressure cuff. We know for some folks, they may not have access to a blood pressure cuff. So if your physician again says, hey, you need to control, your health better by exercising and knowing your numbers, this is a great opportunity to be able to go to the library and check out a cuff as part of that library engagement. We also know in rural areas that agriculture is typically the #1 industry. So we have been working with our Department of Agriculture. We've been working with the industry itself. Here's an example. We were at the Arkansas Grown Conference, just talking to farmers and ranchers about their health, realizing that not only are they part of the food system, but again, looking at their family structure and how do you do this rural physical activity in their areas. And so we also have, here's an example of being in Colorado, working with John Deere to address health of farmers and ranchers, realizing that, again, most of these farms are out in our rural areas, very nature and setting. And we are also working with rodeo, so 4-H clubs, FFA clubs, and really educating, again, that youth part of our next generation and how are we engaging and getting our kiddos outside. Lastly, we're probably best known for our CPR work, but we do know that in most areas that our residents are, 20 to 30 minutes, if not more, in some of our 6 states that I cover, from emergency services. So we have our Nation of Lifesavers work, where again, we really are working on it, everything from 911 and having the person on the phone, the operator being able to tell you how to do CPR, all the way to, again, that quality CPR by teaching CPR in our community settings all the way through what I mentioned in our hospitals. So we hear a lot of work in rural spaces, how we are working with nature programs or walking programs, but incorporating CPR, realizing that safety as we do physical activity is an important piece of the puzzle as well. And then lastly, I talked about our workforce. Jessica will go in depth about our HeartCore program, but I did want to say in the state of Texas that we have 11 sites around the state of Texas where we really are trying to put boots on the ground. We know that this kind of work is very hard, so we want to make sure that we have a staffing model where when we do have innovative projects like Veronica is going to share next, that we have the resources, the staffing, and the local relationships to be able to carry that out. So with that, I will turn it over to Veronica.
Good afternoon. Thank you so much, Jennifer, for that comprehensive overview of our work in rural, the work that we're doing in our rural communities. Next slide, please. My name is Veronica Sanchez. I'm the Senior Director of Healthcare Assistance and Community Impact for the Greater Houston area. Been with the American Heart Association close to 10 years, and I've worked with a combination of several community and with all of our healthcare partners as it relates to our FQHCs, our private clinics, our charity clinics, to outpace cardiovascular disease through our quality outpatient programs. Next slide, please. So, we know that walking can bring an environmental benefits, but there is little or robust evidence that changing the built environment can promote these activities in populations. That was a question that we wanted to see if we could get more information on. We all know that physical inactivity is a major contributor to morbidity and mortality, and increasing regular physical activity, particularly among the least active, is likely to improve the health of these individuals. So when we're looking at increasing physical activity by walking, it's an important step towards a healthier life. People who are physically active tend to live a little longer with a lower risk of chronic diseases such as heart disease, stroke, type 2 diabetes, depression, and dementia. Walking is a low impact exercise that requires no equipment except a good pair of walking shoes and perhaps a safe place to walk. And doing any physical activity is better than doing nothing at all. Our research has shown that walking can have significant impact on the health by lowering your chances of having a heart disease, and showing that walking in a brisk pace for about 150 minutes a week can help you can think better, feel better, and sleep better. It reduces your risk of serious diseases such as heart disease, stroke, diabetes, and several types of cancer. It improves your blood pressure, your blood sugar levels, as well as your cholesterol levels. It increases your energy and your stamina. It improves your mental and emotional well-being, reduces the risk of depression, especially when you do it outside. And it improves your memory and the risk of dementia. And not to mention for women, it boosts bone strength and reduces the risk of osteoporosis. And hopefully it'll help avoid a little bit of weight gain. Next slide, please. So as we know, it can address many health issues that I have listed here. The benefits of walking as related to preventing chronic disease include type 2 diabetes and obesity. Walking lowers the blood glucose and insulin resistance. While sitting all day, driving, or watching TV for long periods of time, it raises the risk for type 2 diabetes. Walking helps with weight loss and weight management. Maintaining a healthy weight is one way to prevent against chronic diseases. Heart disease is a leading cause of death for people of most races and ethnicities in the United States, including African Americans, Hispanic, and Caucasians. It is also the leading cause of death among people with diabetes, and walking is promoted by the CDC, which recommends, again, 30 minutes of physical activity per day, or as we do at the American Heart Association, at least 150 minutes of moderate activity per week to get those benefits. It also helps with joint pain and depression. It's that low impact on those joints. It can be done almost anywhere and does not require any special equipment or gym membership. And dementia, it also helps regular walking, helps to lower developing the risk of developing dementia or Alzheimer's disease, among other cognitive benefits of walking as related to brain health. And so, these are some of the benefits of walking. So what I'm going to share with you next is what we did in Houston. Next slide, please. So one of the things that we did is I partnered with one of our federally qualified health centers, Spring Branch, and the American Heart Association worked together on a multi-year plan towards chronic disease management by layering interventions year after year to help improve health outcomes for their patients. In year one, we really established a self-monitoring blood pressure program, getting the patients used to checking their blood pressures away from their clinical visits to help them learn what their thresholds were, to make them understand what the helping them to understand what the levels were, and helping them learn how what we call how to help the patient get to green. If you look at the lower left-hand corner of the slide, you see a graph that shows the different levels of blood pressure. And so while most patients don't really understand what those mean, we went ahead and color coded them. And just like a stop sign, green means go, it's good. Yellow means caution. The orange is okay. We need to really look at that. And of course, the deep orange and the red is those are the risk factors. So we built that in for year one. Then we layered in year two, we layered on the additional intervention of screening for food insecurity and starting a food RX program, working with the registered dietitians to help the patient understand the benefits of eating healthier foods by adding color to their plate and adding produce. And so we had them partner with the Houston Food Bank as well as the Common Market to be able to provide additional produce for their patient population. Then in year three, we layered on another intervention by ensuring that they were using team-based care and incorporating the entire team as a way to address chronic disease management with their patient population. In year four, they added community health workers, and in the rural communities, if community health workers are not available, perhaps HeartCore could be that other intervention, that other, I guess, the other part of the team within the clinical setting. And then in year five, we implemented Walking RX, which was one way of promoting physical activity to patients that were physically inactive. And it all started with, you know, the clinic knew that they wanted to do something. They knew that they wanted to do something in an environment that would be conducive for their patient population. And in one of their locations, they actually had a park. And when they asked the patients if they were to start a walking program where they would prescribe walking as a way to help address their chronic disease, the answer was no, we don't want to walk in that park. And so when they asked, so then they did a focus group and they asked the residents as well, the local residents around the clinic, as well as the patients, why they didn't want to walk in the park. They said they didn't feel safe, that the park was this particular park is called Pittner Park. It's a pocket park within the inside Metro Houston, and they just said they didn't feel safe. So they invited County Commissioner Precinct 4 Leslie Briones to come out and visit the park, and they asked her the question, "Do you feel safe walking in this park with your children?" And of course, a resounding no. Well, what that did was that brought attention to the park. She quickly committed resources to clean up the park, to make sure that there was sufficient lighting, to ensure that the park was being, I guess, maintained, you know, making sure that the county sheriffs and the county commissioners, not commissioner, but the county sheriff's department was making their rounds to this park to make sure that it was a safe place. They ensured that the lighting was sufficient so that if residents or the patients wanted to walk it in the evening, that they would feel safe. And as a result, once all of these changes were made, so the patients actually advocated for themselves because they knew they wanted to do something, but they just didn't know how to get the park, you know, make the park safe. And because a lot of the patients walk to the clinic because of where the clinic is located, there are several low-income housing units around the clinic, and the park sits across the street. They knew that if they could fix the park, that they would be able to have a successful walking RX program with their patient population. So we actually launched this program last year, and now it is led by a community health worker together with some of the patients, and they have several different times of the day and days of the week where they actually have the walk. They call it a walking club, but it's not really a walking club. It's really when patients get prescribed walking, they get to pick which option of the day, which day of the week, and which time of the day they would like to walk. And so to making sure that they have enough people to be able to do the walk together. And that walk is led by the community health worker. And every time that they do that, they make sure that they document which patients that were assigned this particular activity are participating. They're tracking the blood pressures of the patients. They're actually also tracking the blood glucose levels and the cholesterol levels. And what we found is that the patients were self-promoting it with their neighbors because, again, I said that this park and the clinic are located across the street from several low-income housing units. That now people from the community are going to the clinic saying that they want to participate. And what they've noticed is that a lot of the patients have lost weight. They're in better mood. They're in a better mood because they're exercising outside in the fresh air. They feel safe. They're able to bring their children to the park, and so it has really moved in the right direction. Um, so much so that all when you combine all these components together at the American Heart Association, we really call this a lifestyle RX, right? Because you're changing the lifestyle of the patients by making sure that they are becoming more aware and more cognizant of their physical health and understanding the correlation between the activities of better eating, better physical activity, lowering potentially helping with their mental health, how that's going to help them reduce their risk for cardiovascular disease as well as for a stroke. And so the clinic has now committed to having a goal of having up to 30 groups per year. So making sure that they have the availability amongst all this particular F2HC has 7 clinics throughout the greater Houston area, and they're looking for parks in close proximity of their location so that they can replicate this program in other parts of the greater Houston area. And so we're very excited for this expansion and the excitement that the clinic has, as well as the patients. Whenever when I'm in clinic and I happen to talk to the patients that are participating, they bright up, they just start smiling and they start talking about how they really enjoy the community that it has created to walk as a group, that they feel safe, that they can bring their children, and that not only are they doing this during the day, but they're also doing it after hours so that they can get their school-age children up and moving as well. So that has been one of the benefits of this particular program, and so we in Houston, our team is looking at implementing this within other healthcare facilities that have a park or another way for patients to exercise that would not be a burden and have an additional cost for them to participate. Next slide. And I'll leave it over to Jessica to talk about HeartCore.
Awesome. Thank you so much, Veronica. And hi, everybody. I'm Jessica Donze Black. I'm the Senior Vice President of Community Health for the American Heart Association, and excited to be with you all today as we're sort of talking about how we can address health and well-being via our clinical community connections by leveraging exercise and specifically being outside whenever possible. And so I'm going to talk a little bit about HeartCore as sort of a channel for engaging communities and for connecting clinical and community, and then provide a couple examples of how we have leveraged that to move forward. But I say this more as an example of work that could be replicated in different ways in communities as we're looking to connect those dots. And Melody, to your question, I'm going to put a link in the chat to a really interesting paper that was done a few years ago that looked at that intersection between urban air quality essentially and exercise, and the pro con of physical activity and inactivity in the context of air quality, because it's fairly complicated. Not research I've done and not a place where I will claim any expertise, but it's certainly an interesting article to explore that. There's another really interesting article that looks at the stress reduction impact of different physical activity, and in looking at green space versus urban environments, that found, it was actually done in China, but it is relevant, I think, to here as well. And I haven't seen it replicated. So again, one study, but that found that during the day, there was disproportionate stress reducing impact in green space where it was quieter and people had more peaceful surroundings, because in the daytime, the urban environment with traffic lights and traffic and people and yelling wasn't necessarily stress reducing, but at night they sort of evened out. So if people had safe spaces within their urban environments to walk in the evening, that they could have stress reducing experiences in that environment as well. Not universal, one study, one thing, but really interesting to think about that interaction in that context of where we are getting our activity and doing our walking. And certainly to Veronica's point, safety becomes a really important factor, both reality of safety and perception of safety, just even to get us moving, right? And get us outside and doing things. So lots of interesting places to explore. Jennifer, move to the next slide on this one. So when we're thinking of this concept of HeartCore, I'm going to take a step back and just explain what I'm talking about. So AmeriCorps is a national service program that has been around for almost exactly 30 years. I think we're in our 30-year anniversary. And what AmeriCorps was intended to do was serve national needs. So it is a domestic service opportunity analogous to the Peace Corps. Most people have heard of the Peace Corps. The Peace Corps has international impact. AmeriCorps is essentially domestic Peace Corps, where it's an opportunity for people to apply their skills from the age of 18 to 100, however old people can get. They are qualified. It doesn't require someone to necessarily have any particular educational background, but it's really about applying that interest, that passion, that time and attention to the needs of our communities. And there are AmeriCorps members serving in education spaces. They're serving in environmental spaces. They're serving in conservation spaces and serving in health spaces. Post-pandemic, the Center for Disease Control, or the CDC, and AmeriCorps came together via some additional funding that Congress provided to launch Public Health AmeriCorps. So an expansion of the AmeriCorps service opportunities specifically focused on getting more people interested in and engaged in public health in our country. We, as the American Heart Association, decided that that was a prime time for us to participate in this. And the way AmeriCorps works is, as an organization, you're a grantee from the federal government. The federal government provides some of the funding for service members, and then via match funds and additional resources, you provide the rest of the funding. So we decided to build this core that could help carry forward the work of the American Heart Association, both with the expectation of addressing the public health needs in our communities and building the workforce of tomorrow. So Public Health AmeriCorps has those two agendas, so too does HeartCorps. So if we move to the next slide, HeartCorps is an inaugural Public Health AmeriCorps provider. So we are just learning. We just launched year 3. We have changed, the work has evolved as it moves forward. What's important to note in the case of HeartCorps was we very specifically designed it to help address rural needs that we weren't otherwise addressing. So Veronica, she noted, working in a lot of our staff is working in population centers, so more urban or suburban areas. Our HeartCorps members are all focused on rural communities, different issues, different disparities in those spaces. The program was designed, kind of as Jennifer gave the overarching focus of our work, to address rural health, both by improving health quality and access and addressing nutrition security, and specifically increasing healthy behaviors among youth, both around not tobacco and vaping, increasing physical activity, healthier eating, et cetera. So kind of thinking across that continuum, our HeartCorps members are placed in third-party establishments, so they have brick and mortar offices where the AHA does not have one. And because of that, there's a lot of variability in terms of the work they're doing. Some are in YMCAs or Boys and Girls Clubs. Others might be in senior centers. Others are in health centers or clinics. Others maybe in public health offices or extension offices. So there's a fair amount of variability where people are focused, and obviously that impacts their work. If you go to the next slide. How does it work? If you're interested in this space, or if you know other organizations who have AmeriCorps or are thinking of doing AmeriCorps as a means of expanding capacity, well, we as the AHA recruit, train, and support those HeartCorps members. And part of that is seeking or leveraging additional funding beyond what we get from the federal government to deliver a stipend to them. So they receive a living allowance. It is intended to be enough to live, but certainly it is small compared to the ultimate needs that many of them have, or many of them would like to have. And so hopefully, that's a piece where it's intentionally done to be sort of a living allowance. Members are then placed in these third-party organizations, as I mentioned, and then work with a combination of AHA leadership as well as their host site leadership to address the needs of their community. So at baseline, they assess what the needs are being experienced, come up with a work plan, and then implement against that work plan throughout the term of their service, which is officially, for most members, 1,700 hours. It's about 10 and a half months, but members could be doing part-time or a portion of that year. So it's not necessarily all full-time. Next slide. And so what do? Well, they do a lot of things, but I circled the one we're going to talk more about in the context of our conversation today, given the focus of getting outside and getting exercise and addressing health in these clinic and community situations. What's important to note is because many of our HeartCorps members are actually homed in or placed in health centers, in some cases, their primary point of influence is in fact that health center. But one of the things the health centers identify in identifying people who may have high blood pressure or other chronic conditions are the places where they need greater community interaction and support. And one of those gaps that is often identified is around physical activity as well as nutrition, as Jennifer mentioned as well. And so thinking about how that HeartCore member as added capacity in the community can help connect the dots to engage people in more active and healthy living is often a piece of their role. So if we go to the next slide. So I'm just going to give a couple of examples, and then we're going to open it up to questions or discussion among the group that is here. So this is Casey. Casey is serving with the Destiny Project in Fort Washakie, Wyoming. And as such, she's working a lot with our Native communities in that area. One of the things that was identified among the leaders in her area was that the youth really were not as active as we needed them to be. And so looking to dramatically engage the tribal youth across several tribes and organizations in activities. And so one of the things that Casey has helped to do was to launch what is called the Wind River Spirit Athletics Program. And in doing that, build a huge volunteer corps, leveraging people from schools and tribes to engage the youth in activity. And those activities in some cases are sports or games. In other cases are things like walking clubs and getting outside and exploring. And so really a combination of things, obviously depending on the time of year, indoor or outdoor, maybe more or less appealing, but trying to meet people where they are and engage them in activities that they find fun and engaging. And so I would say the key element of this, right, is somebody needs to be a champion. There wasn't tremendous funding or other things at play there. She had a little bit of supplemental grant support to help with some equipment costs and pulling people together, but largely it was about building the volunteer corps. And so engaging people in the community who were interested to help meet the need and to serve in a way that aligned with their interests and their abilities. So Casey is one example. If we go to the next slide, this is Tylin, and Tylin is in O'Neill, Nebraska. Tylin actually is a certified nursing assistant who'd been working as a CNA for 10 years prior to becoming a HeartCore member and been working in more clinical settings, so really had an understanding of those environments. But in seeing patients over that period of time, was very interested in how do we address sort of those broader needs that people come to the clinic with, in addition to needing medication and needing their health checked. In many cases, nutrition and physical activity and other things were challenges in their life. And so she was just really interested in figuring out how she could engage people in more interactive, fun ways to get active. And so she actually became a bingo size instructor. If you're not familiar with bingo size, you can look that up. But this idea of sort of gaming physical activity, and she works across the age spectrum. So she works with youth, but she also works a lot with aging populations and engaging them in activity that aligns with their abilities and their needs kind of across, and in some cases interactive. She's also just done really creative things, leveraging the resources of the community. For instance, with some of the people she was working with in her in her activity classes, and they also have tried to get outside, engage nature, kind of do things according to what makes sense based on the temperature and the climate and other things at the time. But had identified that there's also a real nutrition issue, and sometimes people's limiting factor to being active and enjoying activity was that they also may not have the nutrition they needed. And so she decided that they needed more sort of pantry outlets, that even getting to a food bank for many people wasn't possible. The hours weren't aligned with their ability or with their access, or the location was too difficult, keeping in mind it's a rural space, so people are pretty diverse, pretty dispersed. So she decided they needed outpost boxes so people could get to different things. And so she actually worked with the high school industrial arts class to build the boxes and made that their project for the semester by working with a teacher. So really getting to know the people in our community, helping to identify where people's natural gifts and opportunities are and what they're interested in, and then leveraging that to affect change is much of the lesson learned through our service workers. And it's probably worth noting too, many of our HeartCore members are recruited from or near the communities in which they're serving. So really intentionally, we're trying to build capacity of people in their communities, not people who are going to sort of helicopter in for a year, do some stuff and leave, but rather how do we build that strength and capacity in the context of the communities where people are living and loving. Next slide. So other member activities, Many are leading activity programs across the lifespan, including walking clubs and communities. Lots of different ways to incentivize participation in those. In some cases, combining them with health education, with health screenings. You see here, this is all of our service members and many of our staff getting trained in CPR so that everyone is able to provide that demonstration if need be, and also be prepared to respond in the case of an emergency or if something happened. Our members are working with schools, boys and girls clubs, YMCAs, and other community organizations to help connect those clinical needs with that community capacity and to make sure we enhance the community capacity as we're identifying people's needs. So really looking to connect those dots in community. And with that, I'm going to turn it back over to Jennifer to facilitate any questions or comments that people may have as you're thinking about how this applies in your world.
Yeah, thanks, Jessica and Veronica. So I'll just summarize by saying I think you heard again a greater Houston that is again working to get folks outside and maybe a park space, but also in our rural spaces as well. And how we're capitalizing. I know I'm always asked, you heard I work specifically with ag, like how do you use those rows, how do you use that farmland? How do you get folks out? And I think from a systems perspective, not only we have a lot of kids that don't know where their food is grown. So even comparing and teaching those nutrition lessons, which you heard mentioned throughout all of our presentations with enjoying the nature of an agricultural field and how that all fits together. So with that, we'll take any questions.
Great. Thank you all so much for the presentations and the information. I was actually a Peace Corps volunteer, so very familiar with that model. I think that's awesome that y'all are applying it to health and heart health and rural areas and where it's really needed. So we do have a question from Melody. She asks how walking in an urban environment with car exhaust, noise pollution, etc., plays into the walking programs that, especially like there in the Houston area, some of these urban factors could be problematic. So how does that work?
They could be in this particular instance with this clinic, because a lot of these communities don't even have vehicles. They rely on public transportation. It's kind of limited. But in other areas where, obviously we have lots of drivers in Houston, it's a very big megaplex when you look at Greater Houston in general, we're a little under 7 million in population. And so that could play a factor, but most of the parks that we have located throughout Greater Houston, whether it's through the Parks Department, through the county, they're still they're away from the big traffic patterns. So while yes, that could be a deterrent, for the most part, our parks are well situated in areas where it's conducive for physical activity.
Great, thank you. And I recall, on the weather they have it's ozone action day or high air pollution. So, people that have medical conditions that, would be impacted by those types of environmental factors, I would think would, kind of plan accordingly and maybe not participate or, adjust somehow. Great. And then we had another question from Melody, again, related to the same program. Parks funding is often tied to state policies and has drastically decreased in recent years. How do you collaborate with parks departments to prioritize park funding?
Yeah. Oh, go ahead.
Just gonna say, go ahead, Jessica, and then we can talk about our advocacy arm.
I was just going to say, we have within the American Heart Association, we do have an advocacy department that's always looking at funding, federal funding to state funding to local, how those funds are being dispersed, as it were, how they're being appropriated given the specificity of things. And certainly we have an ongoing relationship with the National Park and Rec Association, who is also really focused on those issues and sort of where funding is. So funding is always a complex issue across a number of things, but that specific issue of public funding, is addressed within the context of our advocacy work at the federal and state level.
Yeah, and I was just going to add, like, I know specifically in some of our Texas areas, we have been a proponent of complete streets and, pedestrian and walk-friendly spaces. I know in the rural areas, because I've had this experience before, how do you do complete streets in a rural area? Well, it is possible. And Veronica mentioned pop-up parks. So there are innovative strategies even in our rural areas for having that complete street model, that parks and recreation. Relationships and really, like I said, advocating. And I think Jessica and Veronica both said it, like the trickle effect of how one thing then trickles to all the things related to our health, whether it's nutrition, diet, physical activity, high blood pressure, showing that interconnectedness, and that it's not just about a park, but here's all the things that that go along with that if we think about the lifespan of our health.
Thank you. Then we have a question or more of a comment from Jerry. I'm interested in learning more about working with Hardcore in Dallas. We do urban ag and community food forests and orchards.
Yeah, I was going to say, Jessica, I can talk about the creativity we've had of urban rural exchange. As we know, and I don't say that, like we know that you can go outside of Houston, Austin, Dallas, all the places. I used to live in San Antonio, for example. You go 10, 20, 30, sometimes an hour out of the city, and you're in a very rural area with limited resources. And we talked about the social determinants of health and being able to have those transportation options to come into the inner city. So we are working in the Dallas area. We have a lot of 4-H and FFA work that we're doing in the North Texas area. You heard me mention this sort of like, how do we show kids that it's a food system and that there's a whole nature and land part of what we do. So I would just say we'll drop our emails in the chat and be able to talk about that. But I know Veronica and some of her, Emily Paul and Emily English in the greater Houston area, have a lot of rural urban ag exchange with our farmers market programs and thinking about how we do utilize hardcore. For example, we have 2 members with the Houston Food Bank that are servicing Huntsville and Brazosport, being able to say, they're not very far out of the greater Houston area, but they're definitely rural needs. So I'll say that from a regional perspective, and then let Jessica chime in with maybe some other programs around the country that this has been successful.
No, I think that aligns. It's probably worth noting that although our hardcore members are placed in more rural areas, certainly our staff, our community impact staff, are often in those urban centers. So in Dallas and Houston and San Antonio, as well as other cities around the country. And they too can be really great collaborators when it comes to sort of how we work together. So different roles. Typically, our staff are doing more driving towards systems change, connecting dots, helping connect resources in places, as opposed to the more boots on the ground work. But we do, that's another element of opportunity for collaboration with the American Heart Association in terms of being in touch with local offices.
Great. Sounds like there's lots of resources out there for everyone. And it's so cool that y'all are from all different areas. So, our participants can connect with you all and plug into those programs and resources. Yeah, thanks for putting your email. We have some more time, so folks, please feel free to put your questions in the chat. I'm going to put some information. I put in our link to our 2025 webinars. We're taking a break. We do have a partner webinar in December, but public webinars and special health webinars, we're taking a break in December, and we'll be back in January, so check that out. Looks like, yeah, everyone's putting their emails. I do have the evaluation to share to give us feedback and suggest future webinars. So I'm going to go ahead and put that in the chat. But please, anybody else, if you have any questions or comments, please go ahead and put them in the chat now. We can take advantage of having our wonderful presenters with us this afternoon. Just thinking about the walking benefits and the walking program, it seems like that's a real, especially like with our tie and focus to getting kids outdoors and, connecting with nature. Do you see a lot of families engaged in this program, especially like in these big urban areas?
I think Veronica can probably say how many, families they have, but yeah, I mean, I think we do as the AHA really endorse the family unit when we can. I know she mentioned a lot about patients, but patients go home to a family structure and a family environment oftentimes, sometimes intergenerational, especially in our rural areas. So it's certainly something that, we don't necessarily just target the patient, but like, how do you make those lifestyle change across your family, whether it's extended family or household family? So I'll let Veronica chime in as well.
Sure, yes. I mean, yes, we're focusing on the patient because that's who's coming to the clinic. But as Jennifer mentioned, a lot of these interventions really trickle down to the entire family. And as a result, and that's why I think I shared in when I was talking earlier that the patients were asking for a walking club or times that they could walk together as a group with their children later. And that's why we're having more, the clinic is doing more options on weekends and in the evenings so that they can incorporate the entire family and bring, and I think in the fish photo you could see like the moms bringing their little ones in their strollers and stuff so they could also be a part of it.
Great. Excellent. That's what we want to hear. And that's actually been a really popular, program, for our partners and sharing information about it, walk with the doc and park prescriptions and things of that nature. Really trying to make that health and nature connection for folks because it's very important and relevant. And I'm looking forward to getting out for a walk today. I missed my walk yesterday, and you really have to make the effort. Like you gotta like look at your watch and you gotta just say, you know what? I need to just pause on the email and go outside, get some sun and some fresh air, go on a walk. So I love those kinds of programs and all the work that y'all are doing. Any kind of last questions, comments, additional information from any of the presenters about anything that our partners and participants might want to know about?
Well, I'll just mention one other program that actually is in LA specifically, but to your point about kind of getting out and walking and incentivizing it, um, and your walk with the doc reminded me, walk with tend to be somewhat effective programs, both in terms of giving people an opportunity to talk to people, but also sort of two birds with one stone. And this idea of, hey, I want to talk to the doctor in this environment. Our LA Steps program actually started around a concept of building community with law enforcement and the local community because there wasn't a lot of baseline trust and people's perception was that the neighborhood wasn't safe. So the police increased their patrolling, but the increased patrolling actually caused people to kind of step further away from the park and this nature space because it increased their perception it wasn't safe. And they didn't necessarily have a positive relationship with law enforcement. So working collaboratively with law enforcement, we started this LA Steps program, which every Saturday was basically going on walks with the local police as they would come and families would get to know them. And it actually has evolved over time to be really a community opportunity. The local team that was in charge, not just AHA, but others involved, started connecting it with health screenings and with food opportunities. So the food bank would have foods available there. And, during certain seasons, you could do your vaccine, you could do whatever. So you kind of maximize the efficiency of people's time, as well as some of the police officers then started to coach Little League baseball teams and really kind of connecting the community. So I think sometimes, what starts as one thing can really evolve into even more community connection, that many of us are craving those community connections, and walking or being outside together is one opportunity to facilitate that and then being open to where it goes next. So that's just another fun success story that's now many years in progress, and it has really continued in this neighborhood where it began. And so just encourage people to be thinking sometimes starting small can lay roots for something bigger.
Well, thanks for sharing that because I haven't heard of a program like that. That's really innovative and that's really addressing the fears and the concerns and the barriers head on. Like, okay, let's go walk together, the local police and the community members. And it sounds like there's a lot of value in that can come from that. That would be sort of unlikely. So I think that's really cool. Thanks for sharing that. I am just double checking the chat, but I don't see any additional questions. I did want to just remind everybody that our summit is coming up very quickly in 1 month, December 11th through the 13th, and it's in Waco at the Convention Center this year. And we have a wonderful summit program planned, and we have 10 Wednesday workshops, which are in the field, doing all kinds of wonderful things. So if you haven't checked out our summit information, go ahead and take a look at that link. Regular registration closes November 30th. And so on December 1st, the price will go up to $450 for the 3-day registration. But we have some wonderful keynotes. We have David Vella, who's a former head of the National Park Service, to talk about his experience, and also Adam Bienenstock with Bienenstock Natural Playgrounds. So a wonderful schedule lined up. So check that out. And if there's no more, wait, we got one more. Oh, just a thank you. Well, thank you all for your time and all the wonderful programs and information and the work that you're doing in this area of health and trying to, make sure that there's these opportunities for that connection to being outdoors and nature and sharing with, clients and other folks, the value of being outdoors and fresh air and moving your body and all of that. So thank you all so much. And I'm going to go ahead and stop recording.